series of our virtual town halls for our community council spread out across Missoula County. So welcome, and we will just get rolling. We've got quite the agenda tonight. So let's begin with an update from the Missoula City County Health Department and Ellen Leahy.
Okay, whoops, hello. I'm having some slow activity here on Teams, so please bear with me. It's always the technical that gets a little bit tricky. Hello again. I haven't gotten to talk to this group for several months, and we've had a lot of mostly positive changes since that time. So I'm really glad to be covering for our Incident Commander, Cindy Farr, who's taken some respite, and talk with you. The things that I wanted to show you, I'm going to try the share tray here and see if it's going to let me share what I'm trying to show you. Okay. Doesn't seem to be working on the first try. Excuse me.
It is working. We can see it.
Oh, good. So it's showing it to you. Well, that's great then. Let me scoot over here and see if this screen will show it to me. So what you're looking at here is just part of what we have on our MissoulaInfo.com website. And so that's the health department's website. There is the county website. They do link to each other. People tend to visit the county website much more so recently, and we'd like them to, for vaccine availability information. But our other data, including some of our vaccine data, is on this website. So if we look at this, I'm using my cursor here to move along. This is the epidemiological profile, which is, just the shape of the cases that we've had since September. This does not go back to the beginning of the pandemic. We are actually in week number 60 of the pandemic. And the line that we have here is that incidence per 100,000 population, how many new cases averaged over 7 days per 100,000 population. And of course, it's per population, so that you can look at any county regardless of county size. And that population figure has been adjusted, so you're not measuring apples and oranges. And then the goal since last July, issued by the Harvard Global Health Index, which is an international group, and this goal was for COVID, was to not get above 25. Then you will recall we spent 4 months beyond 25 incidents, and 25 is considered the tipping point that you can get a lot of uncontrolled spread. But we have been down since below that since February, and we ride up and down a little bit. And so we have a general descent down. Last week, what I would have said to you is we are in a descent. What I have to say to you this week, and we issue these data and these charts every week, is we are plateauing. So plateauing is better than ascending, much better. But it still gives rise for the possibility of ascent. And if you look at where we are on the Harvard Global Health Index, that tipping point of 25 was here in the red, and our goal was to get down below it, which we did. We spent a lot of time in what's called accelerated spread. And now, even with these low numbers, it is considered community spread. So we're right about in the middle of community spread with an incidence of 8. That does sound so incredibly low, and it is, and it's wonderful. I just want to highlight that until we get down into here, which is 1 case now and then, we still have, just as other counties, Gallatin County, for example, is experiencing quite an uptick, large number of cases. Certain states, Michigan in particular, are actually going through a second spike.
Shall we?
So we are at 8, and we'd like to see that just keep dropping and not plateau. If there's any questions about that, I'd take them before I show you the next. I have 3 charts, and so this is the first one.
Any questions for Ellen right now? And I should remind folks,
So
if you're on your computers and want to ask a question, please use the raise hand function. If you're on your phone, hit *6 to unmute yourself. And unfortunately, I have no way of knowing if you want to speak other than you just speaking. So any questions for Ellen right now? Okay, go ahead, Ellen.
All right, thank you. So this just shows us the age distribution. And we just got off of a trend where it was really the 20 to 29-year-olds that were making up at least 25 to 30% of the cases for several weeks in a row. And of course, they tend to, but not exclusively, have lesser symptoms and sometimes don't know they're contagious. But we've had an interesting change now where it's more the 30 to 39-year-olds and the 40 to 49-year-olds that are making up our current active cases. So we still have the infection seeded throughout our entire population. So whoever you quote hang with socially, and certainly this affects work areas when you're looking at these age groups, we are seeing cases in all age groups and a growing case numbers in particularly the 30 to 39 age group right now. Any questions on that?
Any questions?
So I'm going to switch and start showing you from a different format. So again, please bear with me for a second because the system doesn't always want to jump right in with what I'm trying to do. Okay.
The anticipation is killing us, Ellen.
Did Ellen drop off the call? I think we might have lost her.
I think we did.
Please try and call her in really fast.
Okay.
Ellen, are you back on?
And that was not the system's fault. That was absolutely me while I was trying to change into a different format.
No worries.
What I'm trying to show you, I'm going to give it one more try, and if it doesn't come up, I'm going to ask Adrian to go ahead while I get it so as to not waste your time, and then I'll just come in on after her. So let me give it one more try here. Here we go. It's coming up. Okay, so we prepare this key indicator, and you will find this on our website too, and it'll be under not the daily data, but the trends. And we have augmented it and changed it in the 60 weeks. So this is for April 28th, week 60. But there's a lot of very consistent key indicators that have been here since the beginning. I use these not only to show the public, but to meet with groups like you, use it with our epidemiological consults out of the University of Montana, they have joined us for this entire pandemic through their public health schools. So we have several very qualified epidemiologists that meet weekly with us. Use it with the health board, the county commissioners, city council, schools, other decision makers. And I'll just run through these and then we'll get into vaccinations, which will get us to Adrian. So what I just described to you and showed you is that epidemiological profile, and we've already covered how it's plateauing. We want to see it go down. Even at low numbers, we don't want plateauing, so we're keeping a close eye on that. Again, even at low numbers, which Missoula County has done an excellent job of, we still are what's considered community spread. But that's about the same as, well, I'm sorry, that's a mistake. I just updated this a few minutes ago. Last week we were actually, nope, I'm sorry. On the wrong one. Too many things open. Okay. Our transmission rate, anything above 1 is considered growing, that the epidemic is the pandemic is growing, the numbers are growing. Anything below 1 is considered to be slowing. So we're still riding around and slowing, but again, plateauing. But that's still very good. We've had this number is way up at the 1.8, you know, when it really signifies how many cases that one case spreads it, how many people that each case spreads to another person. And so one person might spread it to 5 people, one person might spread it to 2, but it averages out to, when it's spreading rapidly, sometimes as close as 2. Our test positivity rate, this is part of the Harvard Global Health Index. This tells us, are we testing enough? And because you might look someplace and see, oh, you know, they don't really have a lot of positive tests, but you might see that their test positivity rate's over 10. That means 2 things. That means they're not testing enough. So they're missing infections. We're all going to be missing infections because of the non-symptomatic aspect of this disease. It's pretty stealthy. But it also tells us if we have enough testing, you know, what our infection level in the community is. And we were at times above 10. I think the last time I talked to you, we were probably still up there above 10. So we're down, riding between 2 and 3. We're a little worse than last week. So we're just keeping an eye on that. When we look at how quickly cases are doubling, or how quickly case numbers of active cases are actually being cut in half, those are important indicators. And so several weeks ago, we did switch from doubling, meaning we were still adding cases and we were having one of those upticks, to cutting our number of cases in half. And so every 24 days, we're cutting our active number of cases in half. So that's good. Where we're really having one really brief and I hope longstanding shining moment is the actual productivity, which all of our public and private partners under the vaccination coordination team that Adrienne Beck headed up, what productivity we are with just actually getting the doses out. And our productivity started out in the 2nd quartile. The state looks at where all the counties are and they divide it into quartiles. And we started out in the 2nd quartile, but what Missoula was doing at that time was organizing the vaccine coordination team. And we knew that once that got up, or we expected, and it has proven true, that once that got up, we would be able to Zoom. And Missoula has Zoomed. And as of this week, Missoula County is the #1 county for vaccine productivity, the ability to get 1st and 2nd doses out. So that's great. We continue to have cases, so we continue to investigate them. And we are able to investigate them timely, as long and put people in isolation or quarantine, or if they can document that they're fully vaccinated, they will not be placed in quarantine. So that's a nice freedom, because you can still be exposed, you can still be a close contact. Unfortunately, recently, our numbers of close contacts per the small number of cases have been very large. We've had like one case, for example, have over 40 close contacts. So that's 40 people that could get the disease or could be placed in quarantine. Those who have been vaccinated, and that's documented and they're fully vaccinated, are not being placed in quarantine. They can go on with the work, life, school, so on and so forth, as well as not get the disease. Our hospitalization, I think, was looking a little difficult when I remember talking to you in the winter, and we've been pretty much riding around an average of 5 admits every 3 days, and that is both city and county, county and out of county folks. For the most part, when we're at low numbers, it's about a 1-to-1 ratio. When the numbers go up, as they did when other parts of our state had many more cases than we did, even though we were all spiking, and many more hospitalizations, many of those folks were actually sent from out of county across the state into our our hospitals. And in those cases, we would run 2-to-1 or 3-to-1 on out-of-county to in-county residents. So doing well there, but it's important to point out that even with these low case numbers, our hospitalizations are still active. We have not had a period of time without hospitalizations. The incidence rate that I talked with you about early is currently, as of today, 8. The overall Montana incident rate average is 2. This goes up and down almost daily, so I'm not too worried about this because they're very low. There are many counties that are taking in more cases than we are, but the only one right now and they are the large urban counties. They have the same risk factors and details that contribute to spread. And Gallatin is the county that is having the most difficulty with that right now. But we have started looking at how many cases did Missoula have compared to the entire state average since day one, week 1 of the pandemic. And we continue to show that our efforts in this community, and by our, I mean everyone's efforts, schools, workplaces, businesses, individuals, elected officials, all of you, have kept Missoula County's total number of cases at least 25 to 26% lower than the state average. And we are maintaining that chunk of cases that were prevented from happening. In fact, when you compare Missoula County to its peer large urban centered mixed with rural counties, depending on which county you're looking at, Missoula County is actually as high as, as low as 38% fewer total cases. So this does show us that those mitigation measures work. Vaccine, there's just a whole lot of data here, so I'm going to just try to hit the high points. You will see on our website, and Adrian will talk about, we are, and the health board has adopted a metric as a goal so that when we reach this metric, certain requirements will be relaxed. And this will be the 4th time since we started decreasing in case numbers since early February that the health board, this is their 4th chapter in relaxing requirements. And the key is to do it slowly as a transition, like a dimmer switch, not a light switch on and off. Otherwise, you can get in that situation where Michigan and about 4 other states are getting into, and we hope none of our counties, although they are experiencing some case increases, get into, and that is you get a whole second spike, and it's way out ahead of your vaccine. You can't bring it down with vaccine. You can keep it down with vaccine. So in that race between keeping cases down and getting vaccines up, we have made great progress. And the main way that the board has chosen to measure that progress and to set goals is how many of our eligible population, Missoula residents age 16 and up, because there's not a vaccine for younger than 16 yet, how many have gotten that first dose, which presumes they'll get the second dose. About 98% of them so far have gotten their second dose. But we want to relax things as soon as we see some level of protection, not wait that whole 6 weeks for all the doses to go in. And so they set the metric at 60%. And we were just reaching 53% when they set that. And as of this week, we are at 57.8. You could call it 58. When we reach that metric, and as long as it's after May 11th, and there's a reason for May 11th, then the mask requirement that has been in place since last July will no longer be a mandate. It will be a recommendation from the health officer, and those recommendations will match CDC recommendations, but it will not be a mandate. We have very good norming behavior in Missoula, in many of our businesses and our schools, and we are hoping to continue to use that norming behavior and people's and businesses' preference in schools as they choose, preference to keep the mask mask going a little longer. Again, more like a dimmer switch than an on and off. So we're getting very close to that. If we reach it before May 11th, it won't come off until May 11th. And the reason for that is we weren't open for vaccine. You know, we started with the older age groups and worked our way down. So not everyone who is now eligible has been eligible for vaccine all this time. And there are people that do not wish to shop, go to work until they have reached full individual immunity, which can take 6 weeks from the first shot. So we counted out the weeks from initial eligibility for everyone, and anyone who has chosen to get a vaccine will be fully eligible, fully reach their maximum immunity by May 11th. So that's a change. But we also keep track of what's called how many actually have already reached that point. And by that, I mean they've gotten their 2 doses or their 1 dose of Johnson & Johnson, and then they've been through their 1 or 2 weeks after that second dose, depending, so that their biological system, their immune system, has reached what will be its highest level of immunity. And we're at 45%. We're making good progress there. You've probably heard of herd immunity. Herd immunity is when you look at your whole population, and since our whole population in Missoula County is not yet eligible for vaccine, the board wished to keep track for analytical reasons, and also to keep the goal out that even when the mandates are removed, we still want to push toward herd immunity, because that's what's finally going to put this pandemic behind us. And this is an estimated level of what herd immunity would look like for this particular disease and this vaccine is 75%. And if we look at where we are today, fully vaccinated, we're still down here. So we're doing great. We're leading. We're continuing to increase on all these measures. But please don't think of us as having herd immunity when all these mandates have finally been removed, because we will be far from it at that point.
Thanks, Ellen.
Questions?
Yeah, thanks, Ellen, for that presentation. Questions from the group before we move on to hear about vaccination? Okay, Emily Herndon.
Yeah, any knowledge now on thoughts for 12 and up and lower yet? What's the national and where that's going?
There's not been, we had an update today from DPHHS, and of course they get their updates from CDC. There's not a date certain, but we do know that 12 to 15-year-old trials are underway and the initial evidence is looking good. So I would be willing in my crystal ball to say that we should have, unless something goes south or they have to pause, if they find anything that needs more investigation, they will pause those trials. That's the safest approach to take until it's totally cleared up. So unless we have a long pause, some sort of manufacturing or distribution problem, which we have not, knock on wood, had with Pfizer. And of course, it's only Pfizer that's right now available for 16 to 18, and that's what's being tested right now for 15-year-olds. I think we're going to have it available to give to children before they go back to school. And I know that many of our school districts, certainly our largest one, is already got that in their headlights of how to make it very available.
Okay, thank you. Let's take another question before we probably need to move on to Adrian. We've got a packed agenda tonight. Bert?
Just real quick. We don't eat out a lot, but my question is, when's it going to be kind of safe to go and eat out and rub elbows with people in fully loaded restaurants? Any ideas?
So safety is going to be different for every person. It's going to be the safest for someone who's fully vaccinated and has a fully functional immune system. That will be the safest. In our community, or actually in your own community, where you're maybe more likely in the rural area to eat out if you're not coming into Missoula City. It will be when you actually have some level of herd immunity. So we do have evidence right now. Our bars and restaurants are they had their restrictions released in the third phase. And again, we're looking at the fourth phase now. So they've already had their restrictions released, but they are operating, many of them, under the recommendations that they continue spacing and they continue masks when not eating and masks on their servers.
Thanks, Ellen. Okay, well, thank you again, Ellen. You can certainly stick around in case there's any additional questions that come up after Adrian's presentation, but let's shift to Adrian Beck on a related topic. Adrian, do you want to fill us in on what's happening in the world of vaccinations these days?
You bet. First of all, thank you for inviting me to be at the All Community Council meeting. I understand that my colleague Nick Holloway has given you some updates along the way, and I don't want to belabor any information that is kind of old and stagnant, but I plan tonight to just give you a rough kind of high-level overview and flight through how we got to where we are, what Ellen just indicated, that we are leading the state in our vaccine productivity and our ability to get shots out. And that really has been a whole community effort. I can't emphasize that enough. And that having my job as the director of the Office of Emergency Management, I always feel very privileged to have that in Missoula County because we have such great community engagement and cooperation when we're faced with these kind of situations. So in mid-January, amid a very confusing and kind of uncertain landscape around vaccine availability, how individuals were going to get vaccinated, how much vaccine was available. All we knew is that we had a very limited supply. And so at the request of the health department, who was very busy at that time, still doing a tremendous amount of work in case investigation and dealing with the COVID outbreak itself, county commissioners and the mayor asked our office, the Office of Emergency Management, to take on a kind of a community holistic coordination role for vaccine. As you will recall, in mid-January, it was very uncertain as to what was going to happen, how much vaccine was going to be available, how people were going to get it. And it really was a top-down approach, very decentralized, in that we had individual providers, whether they were healthcare providers or pharmacies, able to register with the state to become a provider, but that didn't necessarily mean that they had vaccine or that they even knew when they were going to get vaccine. And so our goal was really to centralize all of that information to begin to create an infrastructure and a framework for our general public to understand what was happening, and to the greatest extent possible to help them plan for the immediate future based on the information that we could glean, not only from our federal partners but also from the state. Through that, we created a website that I hope is very familiar to all of you, as far as the COVID-19.missoula.co website, where we were able to centralize all of that information from all the different individual providers so that the public could begin to understand not only where they could get vaccinated, but also understand who was taking appointments, who was making appointments, how those appointments were going to be made through different online portals. Understanding that in the very beginning, we were in a eligibility criteria that was pretty exclusive to older Missoula County residents, as well as Missoula County residents who had underlying health conditions or Native Americans or persons of color. We wanted to ensure that we were creating a system that not only could meet the immediate needs, but that could withstand the test of time, and that it was equitable, understanding that in many rural parts of our county, people don't have internet access, don't have reliable or high-speed internet access, or that in some of this older demographic, maybe we're not internet savvy. And so we also stood up a call center, not only to answer frequently asked questions about vaccine appointments, but also to lend a hand in scheduling those appointments directly. And we worked a lot with a lot of our service providers, Missoula Aging Services being one of our key stakeholders and partners in that first phase, to understand what kind of percentage we were talking about. Whenever we would make a clinic available for, say, 1,000 appointments, we were able to determine, based on our data and even just anecdotal information, that about 20% of our population in Missoula County doesn't have reliable internet access or is not comfortable enough navigating the website to kind of compete. And I use that word compete because that's how it was in January and into February, is that vaccination appointments were hard to get. We had a very limited supply. And as soon as appointments would become available, they were gone within a couple minutes. And so we wanted to try to address that issue, knowing that people, especially in that age group and demographic, were very concerned because they were at the highest risk and were most anxious to get vaccinated. Our initial strategy was really to look at how we could be most effective with this very limited supply. And so our first strategy was to work with our providers to determine how we could support what we have now come to refer to as focused and open vaccine opportunities. The focused opportunities were through our primary healthcare providers, who were able to mine, for lack of a better word, data mine their electronic healthcare records to determine eligibility and also to determine who was most at risk based on their electronic healthcare records. Then those providers could reach out directly to their patient base and schedule those folks in for vaccination appointments in their own mass clinic settings, both at Providence St. Patrick's and at Community Medical Center. But we knew that that was wholly unsatisfying to the general public, who maybe has a healthcare provider and hasn't received a phone call yet, or maybe is just so anxious to get a vaccine that they want to just roll the dice and try to get on the internet and try to get the first appointment that they can. And so the other side of that strategy was to provide an equal number of open appointments, and those are those that we would stand up through mass vaccination clinics, either through the Missoula City County Health Department or through the University of Montana School of Pharmacy Curry Health Center. Having these kind of four, what I'll call kind of mega providers in the very beginning, proved to be pretty successful in that when we think about how these first vaccines were being rolled out, and mind you, Johnson & Johnson was not on the market yet, had not been approved yet. So we were dealing with Moderna and Pfizer, which both required a two-shot series, which from a logistical standpoint and from a scheduling standpoint created a lot of challenges. And so we wanted to ensure that not only could we understand how many shots we could get out in a day, in a week, but also what was going to complicate that. And those people that come due for their second shot complicates the number of first shots that we could administer every single week if we were putting everybody into a first shot regime. And so we developed, again, as we kind of affectionately referred to as this Teeter-Totter model, in that between those four major providers, again, Community Medical Center in Providence, working in that focused realm, and the City County Health Department and the university working in that open realm, we would try to push as many first doses to one of those providers in one of those focused or open sides as we could, for as long as we could. And then as soon as they would turn into a second shot regime or scheduling, then we would pivot to the other providers, so that the end goal was that the productivity of each of those sites never changed. They were always giving the maximum number of doses that they could based on our allotment from the state. And it didn't really matter if it was a first shot or a second shot. They weren't going to be hampered by the fact that they now had second shots on top of their first shots, if that makes any sense at all. One of our biggest kind of efforts was just a general public information campaign, working with a lot of you and a lot of your contacts in all of the rural parts of the community to ensure that people understood what that website was. They understood what our call center information line could do for them, but then also working to establish some very early clinics out in remote areas, knowing that we have populations specifically up in Sealy Lake Frenchtown, and even Lolo, who was able to work with Lolo Drug to ensure that we were putting enough vaccine out into kind of the hinterlands, knowing that people were not necessarily satisfied with all the vaccine being available just in Missoula County. And so we were able to partner with Partnership Health Center to work in kind of a hybrid model of a focused and open model to come out to those more rural parts of the community early on. It's important to recognize that whenever we stand up kind of an incident organization, and in this case, we brought in an entire incident management team to work in this coordinated role, we always, at the very first meeting, when we initiate and we set up our goals and objectives, and then those objectives turns into strategies, and those strategies turn into tactics that we can check into routinely to make sure that we're meeting our objectives. But one of the very first things that we do is we say, well, what's our end state? What does success look like? When does it make sense for us to step away from this role? And immediately we identified that our end state was there was going to be a necessity to remain in this coordinated role until vaccine supply, through whatever mechanism that came, whether it was directly from the feds or through the state allocation process, until our vaccine supply was adequate enough that any Missoula County resident 16 and older could access a vaccine without difficulty. And I'm very happy to report that we reached that benchmark about 2, maybe even 3 weeks ago. And so at that time, we began to demobilize our vaccination coordination efforts, and were able to kind of do a warm handoff back to the health department, who really is kind of one of the last mass vaccination sites standing. And if Ellen's still on, I think she will tell you that was always in their thought process, is that we would use as many of these partners and vaccine providers as we possibly could to get as much vaccine out as we could in the shortest amount of time possible, but that the health department would really be the last one standing and would be at this into the future for some time. And who knows what the future holds for us, if there will be a booster shot scenario sometime in the future. But we begin to normalize that vaccination process and get out of these kind of mass vaccination type clinics. So that's about all I have for you tonight, but I'm happy to answer any questions, or more importantly, if you have any feedback from your communities as to if there's continuing challenges or if there's things that we could have done better, I'm certainly happy to engage in that.
Thanks, Adrian. And before we go to Ellen, who has her hand up, anyone else out there have questions or comments? Okay, how about Lisa Thomas? Lisa, you're muted.
I just had a question about upcoming potential boosters for the vaccines, and any word or information on people that have been vaccinated needing a booster in 6 months or a year.
Pfizer for sure is working on formulating a booster. We don't know, since we don't know if they'll be needed, and we don't know when they'll be needed, because we only have the 6 months under our belt with what's out there. But with the emergence of variants, and that's one of the reasons we want the transmission to not just go down, go away, because that transmission is just generating variants. I mean, that's what it does. So in our long-term thinking, we definitely think, okay, let's capture what we've got here so we can be ready for boosters if they are in fact released.
Ellen, did you have anything else you want to add to?
Yes, I don't have dates for you yet, but we are very close to having mobile vaccine clinics that we're probably going to partner up with the visits we've been making with testing all this time, since week whatever. So they will go to, use the same van and then logistically set it up so people being tested aren't the same people that are lined up for vaccines. But so Clinton Bonner is, of course, one location that we regularly go to, and so that will be announced soon. Sealy Lake, Frenchtown, and Lolo. So we've been working in Clinton Bonner and Frenchtown. It's probably going to be the fire halls. And in Sealy, I'm not sure where it's going to be in Sealy. I actually should know that, but Lolo would be the community center. So keep your eyes peeled and help us get the word out when we do release those dates. Thank you. Thanks for having me.
Yeah, thanks, Ellen. Other questions or comments before we have to move on? Okay, well, thank you, Ellen, and thank you, Adrian. Bert, I'm just transfixed on your mood lighting there. It's kind of a heavenly picture that you are presenting to us tonight. Yeah, you're speechless. Okay. All right, moving on.
It's the evening sun coming in the window. I got as much control as I would like to have over the sun. I don't.
No, okay, fair enough. Okay, from COVID-19 to the International Energy Conservation Code adoption. Deb Bell from Public Works, what do you have for us?
Good evening. Thank you so much for allowing me to have this platform here tonight. Thanks to everyone for joining. I'm going to share my screen. So we, as most of you know, the Missoula County Building Codes is, we take our marching orders, so to speak, from the Building Codes Bureau of the State of Montana Department of Labor and Industry. And in February 13th of this year, they adopted the 2018 International Energy Conservation Code. And what that means is that we have 90 days as a certified jurisdiction to adopt that code. So we will be adopting the same code that the state has, and that public hearing will be on May 13th. Nothing like cutting it down to the wire, but on May 13th, we'll be at the public hearing for the adoption of this code. There is one caveat to this. They are allowing certified jurisdictions to either adopt Appendix RA, which are solar ready provisions, at a later date. And so Missoula County is opting to do that. We are going to do a bit of homework on what that would mean, what implementation of that would mean, before we do a PR campaign to inform the public on what that would mean for housing going forward. And I'm happy to take any questions.
Thank you, Deb. Questions from anyone out there? Last chance for questions. Okay. Deb, your report was so thorough. There are no questions to be had, so thank you.
You're quite welcome. Thank you.
Okay. Very good. We are rolling now. The 2021 Community Needs Assessment. Kayla Talbert with Community and Planning Services. Would you like to share with us?
Yeah, thank you. Thank you for letting me speak with you all today. I'm going to share my screen so that you guys can see all these important dates and not just me talking at you. So I wanted to speak with you all this evening to let you know that the Community and Planning Services Department is conducting our annual Community Needs Assessment. And we conduct this assessment to really find the needs and identify gaps in the county that could potentially be projects that we could apply for in the future. And the areas that we look at are public infrastructure and facilities, economic development, and human services. But also in this year's assessment, we'll focus on COVID-19 and specific needs that we as a county need to address any issues or challenges that have come up due to the pandemic. And then we will also focus on housing because we are in the middle of developing an affordable housing strategy. And then by having some questions specific towards housing priorities, it will really provide valuable input for how this strategy plan will move forward. And I'm not sure how familiar you guys are with our community needs assessment, but it's composed of 2 parts, an online survey, and then also a virtual public meeting. The survey is anonymous and it's online. It should only take about 5 or 10 minutes, but it really provides a good overview of all of these different areas and gaps and needs that we should be continuing to think about as we go forward. And as we look for new grant opportunities that come up. And then during the public meeting, we will review the results of the surveys. We'll provide an analysis of what we have found, but it also gives the public an opportunity to provide additional feedback and comment on any activities or projects that they would like to put forth for us to apply for. And those funds are usually for the Community Development Block Grant and Home Grant, which are 2 federal programs that come down through the state that are competitive, but that we do try to apply for when we have projects that come up from. You can find more information about the community needs assessment by going to this link. I will put this in the chat too so that you guys don't have to write it down. But for some important dates, our survey opens on May 5th and it closes on May 19th. And our public meeting is on May 25th from 6 to 7:30 p.m. And that meeting is going to be virtual so that we can make sure that everyone can attend and that we are adhering to social distancing practices. And we really would just like your help in spreading the word about our community needs assessment. We really want to hear from all corners of our county. We have some traditional outreach methods that we will do, but you spreading the words to your colleagues and friends and families will really help us get as many people to respond. And if you also have any ideas of anything that we're missing besides the things that I've listed here, we're open for some feedback, and I'll put my email in the chat as well, so feel free to reach out to me after the meeting. And I can open it up for questions.
Thanks, Kayla. Are there any questions for Kayla?
Would you be also available to come to individual community council meetings to share this information or talk about the survey and things like that?
Yeah, we definitely would be available for that, Lisa. So feel free to email me and we can coordinate on that.
Thanks for the question, Lisa. Other questions? Okay. Thanks, Kayla. Appreciate it. All right, we will move on. And next on the agenda is a presentation on the Homeward's Landlord Liaison and Risk Mitigation Fund programs. And it will not be Carissa tonight joining us, but Andrea Davis. Andrea?
Hi, everybody. Thanks for having us. Really appreciate the opportunity. I'm going to go ahead and also share my screen. And if you wouldn't mind just confirming that I am doing so, that would be great. I just clicked on it. It's just giving me the wheel of death.
Got it.
You can see that okay? All right, great.
Got it. Thanks.
Wonderful. So Homeward is an organization headquartered here in Missoula. We use sustainable methods to strengthen Montana communities by teaching homebuyer education and financial skill building. And we create safe, healthy homes that people can afford. We do that housing development work around the state of Montana. The landlord liaison position is specifically to support landlords and property managers with the idea that we want to create more home options, especially for people that are living with barriers to accessing a rental home. Those might be folks that are they have a Section 8 voucher, which is a rent assistance voucher. And sometimes those that are renting in the private market or property managers might be reluctant to rent with somebody to somebody with a Section 8 voucher if they're uncertain about how that works. Or folks that are living with barriers such as criminal backgrounds or maybe a poor rental reference, eviction on their record. Folks like that are having a very difficult time competing in such a tight rental market. So we are looking to increase relationships with landlords and support them when they're willing to rent to those with barriers. So what we're really doing to support landlords and property managers is we connect the landlord to community resources. And you know, one of the things that I can attest to as a landlord, Homeward develops homes, rental homes that are affordable. And so we are an owner, right? And we do know that, and we've heard from others in the market that sometimes after people find a home, the support that they were provided has ended. And that's not because people just get dropped. It's because there's really a limited amount of resources out there. So when you've got a case manager, let's say with a behavioral health organization, and their client has finally gotten a home, it's not because they don't want to continue to support those folks. It's just that they have very limited resources and they move on to their next client. And sometimes those folks need continual support. And if they don't get it, and the landlord doesn't know where to turn, unfortunately, that might end up sometimes in an eviction. And we all want to avoid that. So our landlord liaison, our staff position, also teaches a course called Rentwise Workshop. And that is a rental education program, largely focused on improving credit and ways in which folks can become more competitive in the rental market. And then our landlord liaison is really there to partner and help foster stable long-term tenancy, like I was mentioning. We also manage what's called a property partner program, and that is where we are asking landlords and property managers to join us in partnership. And we ask them to reduce one or more barriers for renters who have completed our Rentwise Workshop. And that might look like something like reducing the credit score or being willing to take payments on a security deposit or being willing to rent to somebody that does have a criminal background. Those are all examples of reducing a barrier. Our property partner program, we communicate with the landlord liaison if the renter is breaking their lease or they're behind on the rent. So that's an opportunity for just continual conversation and support. There's access to the Risk Mitigation Fund, which I'll detail out here in a second. And we currently have 12 property partners. Some accomplishments that we've achieved through this program to date. The first is these are some case studies. So the first issue was a resident was receiving COVID relief assistance from the state. So the state of Montana currently administers an emergency rental assistance program, which is money that has come through the federal government. And that has been designed and created for those that are not able to make their rent payments because of impacts of COVID. And there's various reasons. There's a lot of money at the state right now. I will tell you that if you know of somebody that is not able to make their rent, reach out to us. We will help connect them with these state resources so folks can get money to help make their rent. They can get money to help pay for past utilities, past rent, and even 3 months into the future. That includes mortgage, folks that have mortgages. If you know of anybody that has a hard time making their mortgage as a result of the pandemic, reach out to us and we'll help connect them to some resources. But back to this case study, this person wasn't able to make their rent. And they basically notified our landlord liaison, and the resolution was that they were able to connect the property manager to the resources, and ultimately they were connected to the Housing Solution Fund and a warm shelter fund, and the renter stayed homed. Another example is we had a property management company who was a property partner, and the tenant was had many noise complaints. The property manager asked the landlord liaison if there was someone who could reach out to the resident in order to comply with the lease. The tenant was not interested in connecting with community supports or complying with the lease. So the tenant and the landlord came to an agreement that the tenant would leave without an eviction. And the outcome there is really a successful exit because nobody wants to go through an eviction. An eviction is very expensive for a landlord and a property manager. And for this tenant, they were able to get out of their lease or their rental agreement without an eviction on their record, which ultimately helps them be able to get into a new home. The last example is we had a tenant that had a previous incarceration and unplanned court fees, and it just made it difficult for them to pay their rent. The property partner, the property manager reached out to our landlord liaison who helped connect them with some community resources to help this tenant pay their rent. And ultimately, this tenant was able to pay their court fees and pay their rent and stay in their home. So all of these are examples of success. The risk mitigation fund is sort of like, it's similar to an insurance policy for people, landlords that are renting to those with higher barriers and higher risk renters. So if you are a property partner, you basically are eligible for up to $1,000 for damages or lost rent. It is covered for the term of the initial lease agreement for up to 1 year. Similar programs see very low utilization rate because of the landlord relationship I was talking about earlier. We really don't want to spend this money down. That's not the point. It's just like insurance, right? We want to make sure that it's there. But if the circumstances are such where somebody has attempted to mitigate these challenges with high risk renters, and there is either lost rent or there is damage, then this risk mitigation fund is there. And so far we have had 2 different situations where this risk mitigation fund has helped make the landlord whole. The idea there is we want property managers and landlords to continue to rent to folks that might have a high barrier. That's our idea there. So this is our contact information. I'm hoping you can see that. I'm hoping that my slides aren't really tiny on your screen right now. Are they?
They're fine.
Okay, thanks.
Yeah.
So the email directly to Alex Ramsing, who is our landlord liaison, is there. It's ll@homeward.org, or you can call our office line, 532-HOME, extension 29. And then on our website, homeward.org, and you can go to Property Partners Program and easily find the information there. And that's really it. Just wanted to make sure that we knew that you knew this program is available countywide. And we do quite a bit of work. All of our programs right now are virtual. So we welcome folks to just get a hold of us and make contact, and hopefully we can get more people into their home and stay housed.
Thanks, Andrea. And before you leave, Andrea, if you could please put in the chat some of that contact information, that would be useful. But let's open it up to questions. Any questions for Andrea tonight? Any questions? Okay. Awkward silence. So thanks so much, Andrea. This is an important program, which is certainly why Missoula County is fully supportive of this, and look forward to continued success.
Thank you very much. Really appreciate it, Commissioner Strohmeyer. We really appreciate the county's support in this. Thanks, everybody.
You bet. Thank you.
Thank you.
Now to a topic that we cannot get enough of, bylaws. Who does not like to talk about bylaws? So we have Lori Heyer from CAPS, who's going to talk to us a little bit. This is in an ongoing attempt to try to bring some greater level of uniformity across our community councils in their bylaws, which is not meant to be a complete straitjacket for folks, but also recognizes that it's probably not best practices to have bylaws all over the map and completely out of sync with one another. So Lori.
Thank you, and good evening, everybody. Some of you probably received an email I sent last week with the new bylaw template that was just approved by the commissioners through a resolution. So the commissioners recently approved the resolution. It's a revised resolution that allows for updates for community council bylaws. The original bylaw template was created in 2008 and hasn't had any updates since then. So they're fairly out of date. And we realized over time that many of the councils have been revising and updating their own bylaws based on the needs of their particular council operations. And what we've realized is that not only were the bylaws so out of date, or the template were so out of date, but that there were a lot of different, well, a lot of the councils had the same requests to make in their bylaw updates. So staff from CAPS and the Commissioner's Office, we worked together to really identify those overlapping issues and incorporated them into the template. So a few of the changes include removal of term limits, and that's something that a few councils over the last couple of years had requested that be incorporated into their own bylaws. And after speaking with the county attorney's office and the commissioners, it was decided that since council members are elected positions, they don't term out. So a council member could be on the council for as long as that person chose to serve. The other change is to include options for councils to actually have alternate positions, and those positions would be essentially voted in the same way or go through the same process as a regular council member. And the councils can have up to 2 alternates. So that's another nice option to have for councils. And by no means is that mandatory, but that is something that councils would have the opportunity to include in their bylaws or come back to it down the road, depending on the growth of their council and the interest in community members in serving. The other parts are talking about the electronic communications do's and don'ts. So in 2008, we didn't have the same kind of level of electronic communications, social media platforms, things like that, that councils are definitely using more and more often these days. So that is something that we thought would be really appropriate to include and to give councils a better framework on how they can do their communications electronically. And then another one we discussed was the funding management, and just clarifying a little bit on how councils are expected to receive any of the funding from the county. And I can speak more directly to some of the other changes. I'm planning on contacting each council to schedule a time to attend an upcoming meeting to have more in-depth conversations, answer any questions that councils may have about the process, about what the expectations might be. And even if you've recently gone through a bylaw update, I think that it's really valuable to look at the template that we've just approved and see how your bylaws align and how we can bring everybody up to speed and on the same page, like Commissioner Strohmeyer had said. So I think that is pretty much my little quick blurb on the Community Council bylaw template update. And
thanks, Lori.
Thank you.
Okay, recognizing that personalized consultation will be forthcoming, are there any questions that folks have at this time? And it looks like Bert has his hand up.
I'm just guessing we don't want to go through these now.
That would be an excellent guess, Bert.
I get one every once in a while. Okay, so Lori, as soon as we can, we'd like to sit down and chat over hours. Okay.
Wonderful.
I think there are a couple of things in the template that need to be a couple of small changes, but then for us, I think there's some other things we want to go through also. Would you like me to send them to you in writing?
Yeah, that would be great. And then I can take some time to look them over, and then at your next council meeting, I would love to attend and be able to provide some answers if you have, depending on what the questions are, and to be able to just to visit about what the process is and what we can do next.
That would be great. Our next one is on May the 10th, I think. So I'll send you the information on it, and I'll give you a heads up on all the issues that I came up with, or that we came up with, and then we have a productive conversation, I hope.
Sounds great. Thank you.
Thank you.
Thanks, Bert. Tom, and then Lee Bridges.
Great, of course. Unlike Bert, hey, let's get into detail right now. I'm just chilling out having a glass of wine. Actually not, but the one thing that, and Lori will, since Bert's council and ours meets on the same date, same time, we'll maybe take your June slot. The area that we're still a little uncertain about is the standing of a council to do something. Like in our case, we applied for a grant and we need an employee identification number, and we didn't have one. So I think that's something that, just down the road, since our communities look to us sometimes to, take an action on something, we'd like to clarify that so we know, as the council, what we can do or what we may need to lay off to another organization in the area. But yeah, I'll send you a note about that, and we'll take your June slot, second Monday, if we can get it.
Thanks, Tom. Yeah, that's a perennial conundrum, and it comes down to there are limits to what councils can and cannot do because they are advisory to the Board of County Commissioners, and unlike other 501c3s that might be out there that can unilaterally and maybe more nimbly take a position on this or that. Let's see, Lee Bridges.
Thank you. This is Lee Bridges from the East Missoula Community Council, and can you all hear me okay?
Yeah, we can hear you. It's a little bit muffled tonight, but you're okay.
Okay, can you hear me better now, maybe?
No.
No? Okay. All right. I'll do the best I can. Anyway, Lori, we would like to reserve you for our September meeting. Our May meeting is full, packed to the gills, and we do not meet over the summertime. So our first meeting after May is going to be in September. We'd like to book you for that. And then Bert Caldwell, would you please put me in on your emails over? Sorry about that. Hold on a second. Would you please CC me in on your emails to Lori so I can be part of that? Thank you. I'm gonna get off here so I can grab this phone call. Thanks.
Yeah, I can do that, Lee.
Thanks, Lee. Bert, do you have your hand up again, or is it just left over from the last time?
No, I have it up again. I wanted to offer Tom Brower the possibility of us having a joint meeting on the 10th of May so that we can both talk to Lori and save her a double round on this. What do you think, Tom?
Well, normally I'd jump on that in a minute. I'd jump on that, but we actually have a full agenda for May because we got tourist season coming up. So we have a lot of the organizations that are going to handle tourists, but I'll check it out. How long do you suppose, Bert, we talk about bylaw? I could talk for hours about it. I love stuff like that.
I try to hold my meetings to an hour and 15 minutes. If you and I want to sit down over a cup of coffee and do this up front and then do it, that'll be fine too. But I really don't care if you show up or not. I was just trying to be polite.
No, that makes sense. Yeah, why don't I'll shoot you an email. Maybe we can grab coffee when I'm in Missoula, going down your way and catch up.
That sounds fair. Thanks.
Tom, you are a rare breed, Tom. It's not often I hear folks who are so passionate about bylaws. So it's good to have a few of those in the world. So I guess another option I'd throw out for folks would be if a representative or a couple folks from a community council wanted to perhaps meet with Lori outside of the community council meeting venue to talk through some of these issues, that might be another option to begin the conversation sooner rather than later.
Yeah, thanks, Dave. I think
yeah, that's a good idea.
I think that could be a good idea for East Missoula as well.
Okay, so I guess just coordinate directly with Lori and she'll get you into the queue. Any other questions on bylaws before we do our traditional round robin of the community councils? Okay. Well, let's do it counterclockwise tonight. Let's start with Violet. You just appeared.
Yes, I was just going to say I have down the list of all the councils representing if you want me to read through, or we can just go round robin too. That totally works. You know, if you have it up, that will save me calling out councils who may not be present and unduly embarrassing them. So sure. Go for it, Violet. Okay. First on my list, I see we have Lee and Lisa from East Missoula. Any updates or questions you'd like to throw out?
I think Lee might still be on that other call. So I'll take this. Just some good news from this weekend. The East Missoula United group here in East Missoula did a cleanup weekend, and we have two dumpsters of trash and one dumpster of scrap metal that got picked up over last weekend. So congratulations to that group out here that got that organized, and it looked very successful on Saturday and Sunday.
Good job.
Awesome. Unless Lee has anything to say, I will move on down to Bonner Milltown, and we have Bert and Emily. Any updates or questions?
No, I just wanted to say that I thought it was terribly just inconsiderate of the president to have us talk tonight while we were having a meeting. What can I say?
For a minute there, you had me worried, Bert. I thought you were going to allege that I did something inconsiderate, but it's only the president, not the county commissioner.
We'll just keep that between you and me, Dave.
Okay.
For the record, I'm the new guy, but I'm on Bonner Milltown too, Rick.
Thanks, Rick. So sorry about that. I must not have you on my list.
I have nothing to add at all.
Okay.
We're just plugging away out here.
Awesome.
Well, congratulations. There's 3 of you from one community council here tonight. Thanks.
Yeah, that's excellent. Let's see.
Oh, please.
Sorry.
Yeah, hi. I'm off my phone call. That was a super important call. I had to make. We're meeting with the mayor tomorrow. I had to get the call. Where are we? Sorry.
Oh, just do you have any updates or questions from over in East Missoula?
Yes, I do. And thank you for letting me jump in the middle of everybody. I'm sorry, Lisa. We have what I call an action committee called the East Missoula United, EMU for short. Those guys this past weekend, did an incredible cleanup day on behalf of the Earth Day that we all celebrate, and it was a ginormous success. I hope they will continue to do it. I would love to see that be biannually, if not more often. And I think that the results were fantastic. There was lots of donations. The dumpsters we got were stuffed full, and I really appreciate everybody's participation in that. So I just wanted to give a shout out to Burnitch's Frame and Molding, who sponsored the site where the dumpsters were set, and to Republic, who donated the dumpsters, and to Pacific, that donated a metals collection recycling bin, and to all of the people who donated and sponsored it and participated in it. So I want to give a shout out for all those folks. Thank you.
Thanks, Lee.
I did have one other thing to add. The highway between East Missoula and Bonner, Highway 200, had some asphalt ripped up and relaid today in one lane and probably in the other lane tomorrow. And so the Marshall Canyon Road problem will be fixed. It's looking good. I went through there today, and that'll make transportation through there a lot easier.
That's good news.
And I think I'm through now.
Thanks, Bert.
Thanks, Bert. Thanks, Lee. I believe we have Dan Sari on the line from Swan Valley Community Council. Dan, any updates or questions? I can't hear you. It's possible that you're muted. Okay, no worries. Dan, we'll circle back if you have something to say later on. Oh, sorry, go ahead.
My name's Kathy Coors. I'm also from the Condon Community Council.
Hi, Kathy. Sorry, I didn't see you there.
No worries. As far as I know, I don't have any updates or anything. We're still recruiting to get 2 members because we have 2 people, myself and our chairman, whose terms are up, and the chairman does not want to continue on. I will continue on if we can't recruit anybody.
Well, thank you so much for that update. Yeah. Is there anyone else from Swan Valley calling in or anything? I don't want to skip anybody. Okay. Next, from Lolo Community Council, I believe we have Warren on the line. Warren, any updates or questions?
No, thank you. Thank you, Violet and David, for a good meeting. It was very helpful.
Awesome. You bet. And then last I see representing is Sealy Lake. Tom, any updates, questions?
Oh, as some of you know, I generally have one of each, but no, I would like to say that we've found our community council meetings be very productive up here, because in April we focused on tourism, expecting a heavy summer, so had glacier country and the Forest Service and whatnot. So our May meeting, we will have also kind of a tourist, like what kind of facilities will we have? Our motels in town were sold. So the one thing that I'd like to put on the radar of the commissioners is that if we have like maximum heavy influx of tourists this summer, which, you know, the indications are sort of pointing that way, that if we have, let's say, a spike in COVID, if we have, you know, just people needing places to stay, that's what it cuts both ways. It's good for the local economy, but, you know, if we run out of space, then I guess we'll send the people on down the valley to Burton Lee. But yeah, we're expecting a busy summer, and we found that this access to the commissioner has been really helpful for us.
Well, thanks, Tom. I see a couple people called in during the meeting. I want to make sure I didn't miss any councils that are out there. Is there anybody else representing any other councils, or just any other questions or comments before we wrap up today?
Well, I'm with West Valley Community Council.
Hello, who is this?
This is Tom Tucker.
Oh, hi, Tom.
Anyway, there's really nothing going on out here. We can't meet at the fire hall because they're shut down. Most of our people are are still being isolated. Also, I'd like to give kudos to the Missoula County Road Department for taking care of some of these dirt roads out here. They were getting pretty bad washboard and potholes. So they've done a good job in getting that pretty close to being repaired, fixed. The washboard's gone away, but as long as the rain stays away, we stay away from the potholes, you know. So thanks, Dave, for having that taken care of.
Yeah, thank you. I'll pass on your compliments to the road department.
Thank you.
Thanks, Tom.
That's all I got.
Perfect. Anybody else? Any other last minute questions, comments, or anything else before we conclude?
Commissioner Vero, do you have anything you want to add?
No, thank you. I know this is running late and we're people, the sun hasn't set yet, so people can get going. Thank you for a great meeting.
Yeah, thanks so much, everyone, for joining us tonight. As I think Tom alluded to, if you're looking for extra space, it sounds like Bert Caldwell has a hide-a-bed that is available for rent. So
I've got a complete bedroom. Okay. You get kitchen privileges and possible use of the bathroom.
Okay.
We love it, Bert.
As always, I'd like to say that these meetings are very valuable, and thank you very much for stepping up and doing this every month.
You bet. Well, thanks everyone, and Bert, let's tie in at some point if there's a collective interest in doing an airport tour. Maybe we could figure out how to arrange that at some point.
I can pretty much arrange it if we can figure it out, and generally they would like to do it on Fridays. So,
okay, why don't you tie in with CAP staff in the spirit of getting the word out, and I'd say just go ahead and move forward. And if folks are in, I saw Lisa put her thumbs up, so there might be interest.
Yeah, I think the construction is far enough along that we get a good idea of what's happening and what's going to look like. So.
Fantastic.
All right.
Okay. We'll be adjourned. Thank you, everyone.
Good evening.
Thanks. Appreciate it.
Bye.